Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go get that free PDF. It's 31 pages. It's a nice little study guide, good refresher on the top 200 medications. I share some of the most important things you're going to see in practice, as well as a lot of things that are going to show up on your board exams, pharmacology exams as well. So again, go get that, reallifepharmacology.com. Simply an email is all it requires to get that, and then we'll get you updates when we've got new podcasts and other content available as well. All right, let's get into the drug of the day today, and that is Senna, often referred to as sennosides as well. Lots of different brand names. This is a stimulant, laxative. So anything over the counter that you see the word laxative or stimulant associated with it, if you look at the back, there's a good chance it might have Senna in it, or potentially bisacodyl as well as another example of a stimulant laxative. So again, Senna is probably the most common name you're going to see there. There are different strengths, dosage forms with this medication. One I see in my geriatric space quite a bit is Senna S. So that actually includes a stool softener. That's what the additional S is for at the end. So that's going to include docusate with that medication as well. All right, so mention the class. Senna is a stimulant laxative. It directly stimulates colonic peristalsis. So basically, that movement of the colon and the forceful contraction that allows a person to defecate and go to the bathroom. So this medication is obviously used for constipation. It's important. There definitely needs to be some patient education. Ideally, with Senna, it is available over the counter, so patients can just go grab it without any counseling or anything like that. But it's always good to keep tabs on patients if they, are purchasing a laxative. See if you can get some information from them. Are they having any high risk symptoms? Are they having some stomach pain, nausea, vomiting? Are they having blood in the stool? So those are some alarming symptoms that should probably get you to refer that patient for more further workup with a primary care provider, just to see if there's something maybe more serious going on than just constipation. So always an important education point with the use of those OTC medications. Before we get to the point of using laxatives for the treatment of constipation, I do want to emphasize the importance of dietary and lifestyle factors. So consistent fiber intake is huge to help prevent chronic constipation. Usual target is 20 to 35 grams. Ideally, from foods is probably the best way to do that, but if we need additional supplementation or the patient's diet doesn't meet that requirement, we can do some other things with supplementation. So fiber is huge. Water intake is huge. Usual target is around 1.5 liters. So that's an important thing to think about. 1.5 liters daily, I should say. At least that. Regular physical activity, so getting that movement, getting that motion, that can absolutely help reduce the incidence of constipation as well. All right, so covering some of those dietary and lifestyle things, I think that's definitely important for sure. I will say Senna is generally not a preferred first-line laxatives. Typically, we go with the osmotic laxatives. Polyethylene glycol, brand name Miralax, is a great example of an osmotic laxative, and honestly, I see that used much more frequently than Senna. When I first started as a pharmacist, I felt like I kind of saw a good combination of both, but polyethylene glycol or the osmotic laxatives tend to be a little bit more preferred due to the way they work and that type of thing. So where does Senna fall in? So if somebody's not responding or not fully responding to just using an osmotic, you may see it used as add-on therapy, or if somebody's not tolerating an osmotic laxative for some reason, you may see Senna utilized in that case. Important thing I want to point out as well. So in addition to managing this with lifestyle changes, things like that, as a pharmacist, please go through that medication list, or have a pharmacist do it, or somebody do it, and look for medications that can cause constipation. Now, there may be meds that okay, this is absolutely needed, that we can't get rid of it. So then it's okay, well, we have to manage that constipation probably with additional medications. But there are many, many times where patients on a medication that's either not effective for them, not doing much for them, whatever the case may be. And maybe we can get rid of those medications and not have an issue with constipation. So some of those targets I see on a daily basis that worsen constipation. Opioids, obviously, first and foremost. If somebody's going through acute pain, hopefully it's acute pain, and they're on opioids for a week, 2 weeks, things like that. That's an important thing to recognize, that it definitely could cause some constipation. We're going to want to pay attention to that. Anticholinergic agents, such as tricyclic antidepressants, first-generation antihistamines, older skeletal muscle relaxants. There's lots of different drugs with anticholinergic activity for sure. Iron's a big one. So that's a big supplement commonly used by a bunch of people. Definitely want to pay attention to that. Make sure that gets reassessed. Do we still need that iron? Calcium channel blockers used for hypertension can have a constipating effect. Antacids, another example there as well. So plenty of meds that can definitely cause constipation. I think it's an important thing to think about when we're going to initiate a stimulant laxative like Senna. All right, moving on to dosing. Typically, you're going to see it Senna used once or twice per day. Maximum adult dose is 34.4 milligrams twice daily. I usually don't see that high of a dose, but occasionally I do a little bit there. Onset of action is actually probably in the neighborhood of 6 to 12 hours. So what you might see is that medication given at bedtime, and then hopefully with that kind of 6 to 12 hour onset, hopefully that will help kind of produce a bowel movement in the morning for that particular patient. So that's definitely something to think about there with the administration of Senna. Adverse effect profile, I would say by most accounts, probably what you're going to see most often is some additional abdominal cramping. Obviously, if it's severe pain, that could be an alarm symptom that, maybe there's something more severe going on here. But some mild to moderate abdominal cramping can happen, which kind of makes sense. If you're stimulating those muscles in the colon to try to help produce a bowel movement, there's definitely some potential that could cause some discomfort and a little bit of cramping and that type of thing. So that's probably the thing I see the most. Occasionally you may see nausea, that type of thing. Don't sleep on diarrhea. It makes sense that this medication could cause some diarrhea. And I've actually seen patients where they've been struggling with chronic diarrhea and nobody noticed that they were on a stimulant laxative. So pay attention when you hear somebody reporting diarrhea. Make sure they're not taking a chronic laxative, because I have come across that certainly more than once in my career where it hasn't been discontinued or somebody missed it or whatever the case may be. Some rare things, you may see some electrolyte disturbances. Usually that's probably more in the case of, it causing, frequent stools and that type of thing. So something to be aware of, particularly with, chronic prolonged use. Again, I'm generally don't come across that in practice too much, just because it isn't used that excessively to that extent in most situations. So, and then there's this idea of kind of dependency with chronic use, in regards to that. So, ideally, we want to try to, use these medications short term if we can, and get those diet lifestyle interventions going as well, in addition to kind of getting them through their initial phase or their initial aspect of their constipation that they've just encountered there. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like BCPS, ambulatory care, BCMTMS, geriatrics, NAPLEX, go check out med101.com/store. We've got tons of resources there, have helped thousands of pharmacists and pharmacy students pass their exam, and can absolutely help you too. So go check that out. Support the sponsor, med101.com/store. All right, drug interactions. Not terribly concerned with drug interactions. That Senna works pretty locally within the gut. So I generally think about some of the, additive things that can happen. So if you've got a patient on significant diuretics, for example, and, Senna maybe increases the amount of potassium that's eliminated through the gut, for example, we could potentially have a little bit of additive effect there. Okay, so not typically something I'm too concerned about. We're probably much more likely to address the diuretic in that situation than we will be the Senna, but again, might have a small kind of additive effect in that situation. And then I always think about, kind of the yin and the yang with constipation medications, trying to basically counteract the effects of Senna. So if you've got, patient on an opioid, or you start an opioid in somebody that's taking Senna for chronic constipation, it's going to potentially, kind of counteract that effect. So think about those meds that I listed previously as well in potentially counteracting the effect of the stimulant laxative if we start them or potentially increase the dose. Last, I will mention warfarin. If we get to a point where we're causing frequent stools, maybe more so leaning on the side of diarrhea, that could, in theory, certainly reduce vitamin K absorption, which could obviously affect the INR a little bit there. So, again, just something to think about. Again, I don't have a crazy high risk in my mind on drug interactions with Senna. But there may be a couple things just to pay attention to if you see something out of whack anyway. All right, well, that wraps up the podcast for today. Thank you so much for listening. Do me a huge favor. If you enjoyed this episode or found this podcast helpful at all, do me a favor, leave a kind rating review on iTunes or whatever platform you're listening on. Greatly appreciate that to all of you who have taken the time to do that. It definitely means a lot to me for sure. So appreciate it. That's what I'll say to that for sure. If you want to reach out to me, Eric Christensen, PharmD, BCPS, BCGP, you can track me down on LinkedIn or mededucation101@gmail.com. If you got any comments, questions, suggestions, I do the best I can to try to respond to all my emails. So don't hesitate to reach out there. With that said, thank you so much for listening. Take care. Have a great rest of your day.